February is American Heart Month, and heart disease is the #1 killer among men and women in this country. This Yonkers woman is a survivor. She says she has no idea the pain that she was experiencing were the beginning stages of a heart attack. She says she started suffering from occasional pain that traveled from her waist to her head, and was only after she had a headache that she actually went to the Westchester Medical Center's same-day cardiology program. There she learned she was actually having an impending heart attack.
We are not men. We don't have a man's heart attack. We don't have that pain down the left arm that I always heard about. We have different symptoms.
Now, cardiologists say to be on the lookout for symptoms like shortness of breath, heart flutters, or even chest pain. Now, today is also National Wear Day, raising awareness about heart disease. Joining us now is Dr. Shalini Bobra from the cardiology department at White Plains Hospital. Thank you so much for being with us.
Thank you for having me. Very excited to be here during Heart Month.
You just heard that Yonkers woman's story about what a close call she had. Can you talk to us about the differences between men and women when it comes to heart attacks?
Yes, despite the tremendous advances in the medical arena, heart disease still remains the #1 killer. More than breast cancer, uterine, ovary cancers, cervical cancers, all combined. So her story is something that we hear, unfortunately, far too often. And part of that is because the symptoms in women are sometimes hard to recognize, as she said. So in men, we tend to hear about those classic left-sided chest pain, crushing, radiating down the left arm, sort of what we see in the movies. But for women, it can be more subtle. So even though chest pain is the most common symptom for both men and women tend to describe it more as a tightness or a squeezing. It can go down the left arm, but it can actually go and travel to other areas, such as up the jaw, through to the middle back, to the shoulders, and even towards the stomach. So it's very important to know about that. The second most common symptom is something that we call feeling short of breath. So even with minimal activity, women can feel winded. And that is something that we have to have a good idea about, because that can often get mistaken for asthma or other lung problems, when in fact it could be the heart.
And just quickly, let me talk to you about the fact that we have more knowledge about the symptoms. Talk about the advancements in technology to treating this.
Sure. Luckily, when this is recognized, we know that time is muscle. So the sooner you arrive to our emergency room, the sooner you can get treated. And we have advances in technology, such as recognizing that the blockage is there. That's the most important thing. And then immediately transferring you to get treated. We have specialists who take care of all aspects of heart disease at White Plains Hospital, including heart attacks, heart disease prevention, the heartbeat, the rhythm of the heart, conditions like atrial fibrillation. We have the interventional cardiologists who are there 24 hours a day to take care of you. And we've also launched a minimally invasive heart program to take care of conditions such as aortic stenosis. Right. So we provide the whole spectrum.
The whole spectrum. All right. We appreciate your knowledge this morning. Thank you so much for joining us.
Thank you.